Okay, we're live.
Good evening to all our wonderful speakers, health professional, mental health practitioners.
Keep talking. Keep talking.
Thanks, and to our general audience, good evening. Happy New Year. I will start by introducing myself. My name is Cole Frangalo. I'm the CEO and founder of Community of Angels. Community of Angels is a global health organization empowering health care professional and health center around the world. We're currently working here in Minnesota, in West Africa, and empowering our partners in East Africa as well. And I would just like to go around and have everybody introduce themselves, and then we'll get into the program. Thank you. Ms. Keisha?
All right. Good evening, ladies and gentlemen. Happy post MLK Day.
Yes.
Hey, Martin Luther King. Absolutely. He's the reason why we all can kind of sit here today and have this conversation. Absolutely. My name is Keisha Hazlett. I am a speaker and a nurse in the community. And my favorite thing to do is just prepare our frontline workforce for public health work efficiently and carefully and lovingly, if that's a way. All right. Miss Emma.
Hi, everyone, and Happy New Year. I know it's late, but technically we're still in the new year. I'm Emma Boley. I'm a trained epidemiologist researcher. I've done research and evaluation of health programs and systems in Minnesota and also globally, working in Liberia, and then also supporting research and evaluation projects in Sierra Leone, Malawi, Lesotho, on behalf of Partners in Health, which is the organization I work for. Is a global health organization. But on this project, I've been supporting Community of Angels with some of that program implementation as well as evaluation of that programs.
Oh, it's on me now?
Dr. Chesler.
Okay.
Is she on?
Hi, Mom.
There she is.
Hello, I'm Dr. Alfred Manchester. I'm a family medicine provider in a rural community in central Minnesota. I am working with Community of Angels as one of the trainers for our COVID response. And I'm glad to be here this evening.
Thank you very much, Dr. Jessa. Thanks for joining us.
I'm Sam. I am a mental health provider here in Minnesota. Operate a private mental health clinic in Minneapolis. I'm glad to be one of the presenters here tonight.
Perfect. Thank you.
Thank you very much, Dr. Kwan, for joining us. We have two more ladies join us. Joyce is in Kenya right now on a business trip, and she has some trouble logging on because of the time difference. So she will join us sometimes in the program. I see Fatuma is on. Is she on?
I'm here.
Okay.
Oh, is it my turn to introduce myself?
Yes. Please introduce yourself.
Hi, my name is Vidumo. I'm a mental health practitioner and a nurse. I've been working as a mental health practitioner for the past couple of years, and I'm glad I'm here.
Thank you very much for joining us. We're happy to have you here. Thanks to you all for joining us this evening, for always making the time to serve humanity. This program was made possible through the partnership with the Minnesota Department of Health. Our aim for this program is to ensure that our community, the African-born community, have equal access to resources, to trusted COVID messages, and to increase the vaccination rates and education in our community. So thank you very much for joining us. We will start out by asking some questions, and we will go into answering those questions and giving us some of your expertise, your experiences in the field of work. And we can just start from Dr. Kwam. I know this is your line of work. the mental health aspects of COVID. And we have Fatuma on the phone, who is also a mental health practitioner working in the East African community. So we one of the questions we have about mental health when it comes to our community and COVID, there's a lot of stigma. How are we resolving those issues, and what are some of your the tips that you can give to our community that we can help to resolve the stigma when it comes to mental health and COVID?
Um, so one of the things is like I work with clients on a one-on-one basis, and one of the things I've realized that has helped is them people explaining it to them that they are familiar with, like kind of like the same culture or the same background, and explaining like the myths, because there's a lot of myths about the vaccination and like COVID and everything. So it's better when a person that is of their own kind explains it, better than when it's someone like a doctor who's a different ethnicity, you know. So I think ethnicity plays a big role because of the whole like trusting. So I've realized like they take it more well when we try to explain it than
Mm-hmm.
their doctors.
Okay. So, Fatima, I know you work in the Somalian community and you're from Somalia as well.
Yeah, I
So,
work in the Somali and the Ethiopian.
the Somalian and Ethiopian community. So, from your experience having people of your own going into the community and talking to family member and loved one, the community is usually receptive when it comes to
Yes,
education.
yes.
Okay. So, you talk about trust. Can you just tell us a little bit about that? Why do you think that there's a lot of mistrust? People are not trusting the information. People are not trusting the process.
I think it's because of like the whole being so culturally bound. Like they stick to their own kind. Like they don't go out in public and interact because the language barriers. So they're usually going to the stores of their ethnicities, to, you know, they have interpreters of their ethnicities to speak the language for them. So it's more, they're more comfortable. Comfortability, it's what creates it, I would say.
Mhm.
And they just haven't been around different cultures, because back home, if you look at it, they all just live within each other, you know, like their own villages, and that's all the life they're used to. And now at a 60 years old and 70-year olds, because that's around the age range I work with, you it's hard to explain to them and for them to trust somebody they just met, you know, from some they knew their whole life.
Mhm.
Because back home, they're doctors, they're nurses, they're teachers, everyone is the same ethnicity.
Yes.
I think that's where it stems from.
Can I add to, there's a component too of the fact that the information keeps changing, not just the fact that who's bringing the information. The information keeps changing, keeps evolving, and that in and of itself can just lead to mistrust, because you tell me one thing today and then tomorrow you tell me something else. It leaves people uncertain of whether or not they can trust what you're telling them. So while the cultural aspect is a major aspect, the fact that especially with the COVID, information has been evolving over time. So what is said today, for instance, there's mask up. Then you come back and say mask is not of any benefit. That leaves people in a little bit of a confusion too.
Mhm. Mhm. Okay.
Absolutely.
Yeah. So the information keep changing. There's always new information. So that's why it's important to, as health professional and messenger and a professional like Fatuma, to also to always keep updated with current information, to be able to go out in the community and give the most accurate and updated information about COVID. Dr. Pan, I know this is your field of work as a mental health practitioner. Can you please go ahead and just let us know a little bit about some of the challenges that you're facing in your practice when it comes to mental health, stigma, about even getting help from with the mental illness? Can you just talk to us and let us know a little bit about that?
Well, the issue of stigma is real. Um, And the fundamental reason that stigma still exists is ignorance. We don't
Mhm.
know a lot about mental health, or we have not been able to talk a lot about mental illnesses in our own communities. And so our perception of any form of mental illness is usually the worst kind. Even when you hear the word mental illness in our community, um, it's like the only thing they know about is schizophrenia or psychosis. They don't know about the other types of mental illnesses like depression or anxiety or even PTSD. They don't consider those. So because the exemplars we have in our society are like the worst kind, the stigmas exist. Even though we have distrust with the system here based on history, but we ourselves as a community have not made enough effort or stride in actually knowing what mental illnesses are there and how we can get helped. There are a lot of myths that still exist. Mental illness in our society is still seen as a weakness. uh, it's still seen like you just got to make up your mind to get better, and then you will get better. And there are other perceptions that persist, like once you are diagnosed with mental illness, you can't get a job, or it will never get solved. So that's a lifetime illness. Or there are even like perceptions or myths like the mental illness is contagious, so that
Mm,
when somebody has mental illness in a community, nobody even wants to talk to you, so they
mhm,
can catch it, right?
Mhm.
So
mhm,
unless we as a community, as a culture, as a society, unless we put some effort into knowing what mental illness truly is, we can even accept the fact that it is pervasive in our communities as we speak today.
mhm,
Yes.
mhm, mhm.
So, like in your practice, do you have are you just treating people with like mental health, or do you see COVID patients or people that come in with symptoms?
Um, when you have COVID and you have symptoms, you practically stay home. You
Mm-hmm.
don't come to the clinic. But yes, we practically treat people. We primarily treat people with mental illnesses.
Mm-hmm.
But when people have COVID, people who also have things like anxiety, COVID has other things, right? That either make the COVID worse, right? Or make
Mm-hmm.
it deadly. So there
Mhm.
are people with underlying predispositions that can make their COVID worse. So we will be able to treat some of those predispositions, but COVID itself, we don't provide medication for the actual symptoms of COVID.
Mhm.
Okay. So, Dr.
Hi.
Emma, okay, yeah,
Yeah,
you can
I
go
would
on.
just I just want to add a little bit of what piggyback on what was recently said. I think what is important to know that from a scientific perspective, we don't know everything we need to know about COVID. So I think as practitioners, whether clinicians or public health practitioners, it is incumbent upon us who are closer to the work to be able to explain to our community why these changes exist. It is true that there are a lot of research out there showing that trust is an important predictor of whether someone gets vaccinated or not. However, the it's not when information is changing, it doesn't make it less valid. It just means that
Mhm.
the situation is involved in, and with viruses evolve. Therefore, there's different strains every now and then. Therefore, we need to be revaccinated. So I think as public health practitioners, the onus is on us to
Yeah.
make sure that we explain to ourselves, our served communities, why things are changing and why there's different updates every single time from a scientific perspective. We expect things to change because with viruses, things change. And then the other thing I would just say is that uh, we need to be clear and emphatic that mental health is not the same as mental illness. And I'm not a clinician, but we need to not equate the two. I think when we're talking about mental health, we're talking about, having positive mechanisms with coping with stress, with coping. Like I can go see a mental health practitioner, not because I have mental illness, but because I want to prevent mental illness. I may want to just have a safe space to be able to talk to someone so I can be able to understand how to deal with stress in a positive way. So I just want to put
That's
out there
true.
is that when we say mental health, it doesn't need to come with this terrible connotation, bad connotation. We as Africans, we need to, when you are going to talk to someone, to be able to develop positive coping mechanism, it doesn't mean you're crazy. It actually protects you from being crazy. So I think
Thank
we
you.
need to have conversations around being proactive around your health, and your mental health is actually positive and it's a good thing because it prevents, you know, adverse outcomes down the line. And you being sick is not an issue, but we need to be proactive around preserving our health and our mental health and developing positive mechanisms. So I just want to say that, we need to have conversations around mental health and outlines the advantages for seeking help, for developing positive mechanisms. And also, when you are sick and you need someone to talk to, it's also important, but it's important to develop skills to cope with stressors in life, because stress is a part of life. You
Mhm.
just have to figure out if you're going to positively deal with it or negatively deal with it.
Well,
That's a
thank
my,
you,
yeah.
thank you very much. I was going to say, like, I spoke to a group of men recently, and I was telling them, hey, I like to see you when you are healthy and nice and everything's going well. Don't wait till you get a nervous breakdown before I see you for the first time, right?
Yeah.
Um, and like Dr. Bully was saying, is good mental health is a good mental health prevents mental illness, right?
Mhm.
So yes, so it's a preventative thing. We all need a safe place where we can go and get some things off our chest. We all need a safe place where when we can figure things out or we need to understand something, where we can go and say, "Hey, I got a question. What is this thing? What does it mean?" And stuff like that. And that's some of the services we provide, right? And it's true that the burden is on us to get out there to the society and try to disseminate the information we know that mental health is a good thing,
It's a good thing.
right? And
Having a
mental
good
illness is not necessarily a sentence of death. You can get mental illness and there's good treatment. Not everybody that comes to treatment have to stay on treatment for life. Not everybody that comes to treatment takes medication. Some of the treatment is just therapy, right?
so, that's very
Yes. Can I add
that's
on
very
something on
important.
that with a follow up?
Yes, sure.
Something I've realized is a lot of them don't know the symptoms, the signs and symptoms of it. So educating them, um, teaching them that it doesn't make them less of a person. I've realized like some of them they will tell you like, hey, can you keep it confidential, even though it's confidential of the work we do with them, the therapies. They they perceive it as like, oh, I'm a less of a person because I'm depressed, or I'm a less of a person because I have PTSD. Like after explaining to them about their symptoms. So that's another thing and another important thing is these older patients have a harder time understanding the signs and symptoms of like depression, PTSD, anxiety. So those are things
Okay.
that we got to educate them on.
Yeah. So, Fatima, yes, as you talk about, dealing with the older community, I mean, the older population in your community, like the 60, 70 years old, and where, Africans that migrate from here, from Africa, where, most of our parents and elders are used to going through a lot of trauma that they never got help for, that was not resolved. So sometimes it become a way of life, and sometimes people see it as a weakness going to ask for help for something like stress, like depression is supposed to be a normal thing. But the education that those depression, stress, the impact it can have on our body and our physical health, so that need to be educated, and letting them know if you have the benefit to receive those services. And going back to what Dr. Pan said, um, just like it, people have been educated to go every year and do the annual checkup. Mm-hmm. And I think most people are okay going with the doctor knowing that, okay, I'm going to go this year to do my annual physical, and I'm just going for my annual physical, and I don't have to be sick to go for my annual physical. Mm-hmm. So Dr. Pan just really said something important. Part of your annual physical should be your mental check-ins as well. You do not have to have a mental breakdown. You do not have to have, mm-hmm. you do not have to be depressed or, have, symptoms to go. Mm-hmm. Make your mental check-in as part of your physical check-in. Mm-hmm. And that's a key lesson for me too, because it's normal in my household and I know in my circle for people to go and do the annuals, but part of my annuals have never been going to check in with my counselor or my mental health. I don't even have one. But I mean, honestly, I guess I have one now because Dr. Pan is right here, and I will check in with you. And this is a good education, especially from an African woman. I do not have a therapist. I do not have a counselor. I do not have, and I think I need to add that to my primary list. And I'm encouraging people to add that to your primary list because time is changing. Information is changing. The world is changing. So we need to add that, and that's a very, 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 very valid education, even for me that's sitting here. Mm-hmm. So the rate for vaccination it's not increasing in our community, especially like the African born, the minority community, and that's one of the reasons we're here. We have these resources available to us, and from a scientific perspective, I will talk to Dr. Emma and then Dr. Chesa. Maybe I should talk to Dr. Chesa and then we can ask Dr. Emma. Dr. Chesa, from in your practice where you work as a medical doctor, how have COVID changed the system or the way that your day-to-day operation compared to before or even now? What have changed? What is different? And what are you doing to fix it?
Well, I mean, when you work in the healthcare system, we have people who put in policies and practices in place to mitigate some of these changes. The biggest thing that has changed now from a medical perspective, from a daily practice perspective, everyone who comes in with the sniffles, you get masked. That wasn't the case before. If you walk in and you have a cold, you have a fever, you have sniffles, the first thing we think about now is COVID, and you get masked up before you even come into the facility. That's a huge new practice in how we practice medicine now. That wasn't in place before. Mm-hmm. And every time you see a patient who has a fever, a cold, nasal congestion, the whole 9 yards, normally we'd say this is just a cold, no big deal. But now we're checking for COVID on every patient who comes in with those symptoms. That's a big change. Additionally, now we are making sure we are including the fact that you've had COVID. If you've had COVID one time or 10 times, it doesn't really matter how many times you've had it. But if you had it at all, it is listed on your problem list. Simply because we know that having had COVID puts you at risk for different things down the road. So we make sure we keep down your problem list. Whereas if you have a cold, we don't care because you're going to get a cold again, maybe multiple times a year. It is not listed on your past medical history. It is not listed of. But with COVID, it becomes important that we know you've had COVID. So if down the road something else happens, thinking in the line of what COVID does to the patient's body and how it affects them long term, we start thinking of those long term effects if you can't have other issues in the future. So the two main things as far as our daily practice of medicine in my facility right now. Number one, masking, and everything becomes a COVID rule out until proven otherwise. And number two, COVID has been included in your problem list if you've had it. So we know to start thinking of other adverse effects from COVID down the road if you have some other symptoms.
Thank you so much, Dr. Chester. That was, and I just wanted to ask you one more question so we can move on to the other speakers. If I'm coming to, how do I prepare now, today, if I was to go see my doctor? What do you think would be helpful for me to do if I'm going in to see my doctor? Let's say for just a general checkup. What tip do you have? What would you recommend your patients do before they come in?
Well, I tell my patients before you come, if you have any questions, write them down. If you
Mhm.
don't write things down, you're going to forget. So write your questions down that you want to ask your doctor, especially if you're coming for your annual checkup, your once a year checkup.
Mhm.
Write your questions down so you walk in, you already have a list of things you want to address with the provider. That's the main thing. If you have any symptoms for COVID, it is advisable you, and if you have any cold symptoms, nasal congestion, fever, sore throat, nausea, vomiting, changing your appetite, let the check-in desk know in advance so you can be masked up before somebody else comes in to see you. Because by the time you see the doctor, you've already gone through multiple layers of people who've interacted with you. So if by chance you have all these symptoms, and God forbid it is COVID, no one tells us in advance that you have all these symptoms. By the time you already infected multiple people before you get to the doctor. So the onus falls upon the doctor, number one. Make sure you have a list of things you want to
Emma,
adjust.
can you mute, please, for
And
a
number
second?
two, make sure you have
Thank you.
your disclosing with the clinician early enough so you can be masked up to help to protect the medical staff. That's the two things I would recommend.
Perfect. Thank you so much, Dr. Jessa. Emma, this question may be for you and anyone else that can answer. And we're coming more back to our OVA and mental health. But I want to talk about some of the scientific evidence or factor that you are aware of when it comes to the vaccination. There's a lot of myth about the vaccination. And there's still a lot of hesitancies. Many people have not gotten vaccinated, including someone that's sitting next to me.
Are you trying to?
So
Is she trying to oust me? Like,
many people have not gotten vaccinated. There's still a lot of hesitancy.
Practice.
Well, I don't have facts, but at least the last I checked, somebody has not gotten vaccinated. Someone, okay? But anyway, there's still a lot of people that do not want to take the vaccine because there's a lot of myth, or it's made too fast. It's made for certain ethnicity to create certain disease in them. It may cause infertility. So I just want to know how safe from scientific evidence, not personal perspective, from scientific evidence, how safe is this vaccine? What would be your message to the public, Dr. Emma, and anybody else that can answer it? Is the vaccination safe?
So before I get into that, I just want to say something quickly about mental health. I think the perception that we Africans, we don't talk about problems, we don't talk through things, we like to keep things in. I think that's wrong. I think culturally we're used to calling a friend, we're used to calling our family members and chatting about things, and then you know I think we need to channel that into a health professional because your information is much more protected that way. If they were to put it out, you can sue them. You still can sue someone from saying something out there, but healthcare professionals have a burden to be able to protect you and keep your information safe. So I just want to urge people, instead of calling your girlfriend to be able to talk about your personal issues, I think it is best in the US that you have a mental health professional to be able to talk to some of the things you are going through. That way you have, not only clinical advice to be able to deal with stress, but also they can be able to help you navigate some of those challenges. I just want to say that with the vaccines, I will say things like vaccines are made before vaccines are even brought to the market. They'll look for safety. Safety is it's a golden standard. The first thing is the vaccine safe before they look at efficacy. So safety is it safe? Is it going to cost if the benefit isn't going to outweigh the risk or the
Mhm.
adverse effect. Everything has side effect, but usually the first test when a vaccine is being made, they look for safety. That's the baseline test. The next test is it efficacy? Is it going to do what it says it will do, or is it going to make sure that in the people who are receiving the vaccine, they are going to be protected against the virus. They may still have it, but reduce the severity of impact. So COVID-19 vaccine is safe. And it's also it is effective to be able to prevent COVID and also to reduce the severity. There are a lot of studies out there showing that people who took COVID-19 vaccines compared to people who did not, they had better outcomes, whether it is they were more likely to survive infection, or if they got COVID, it was less severe. So there's a tons of evidence to be able to say that not only is COVID-19 safe, it is it is
Effective.
effective in preventing and also reducing the severity of COVID. So the bottom line is you are less likely to die from COVID-19 if you have the vaccines. Now, there are people that have different, effects. Vaccines will treat people differently, but that's still predominantly, you are more likely to be able to have a positive outcome with being vaccinated and not being vaccinated. And so there are a lot of myths out there around the COVID-19. Yes, COVID-19 in history was created in 18 months. That's because the resources put into COVID-19 has never been put into any other vaccination. Therefore, with the expediency, I can tell you for a fact that 2020, I was stuck in the US here. Everything was shut down. I needed to go back to Liberia to be able to help COVID-19 response. And I had my employer at that time, Partners in Health, wrote me a letter to say I needed to go Liberia. I took that letter to the US passport center in DC, and I was amazed that I got a passport printed out in 30 minutes, something that typically would take us 6 weeks. So what is that saying is that the US government, not only the US government, but people as a whole can do anything if there's will to do it. The US government poured enormous amount of resources in getting a COVID-19 vaccine because it brought the entire nation at a standstill. And so that's why we got a vaccine in 18 months. And I can tell you, compared to other, viruses like HIV, where, we've had HIV, I would say pandemic, it may not have killed so many people in a short period of time, but over 40 years, HIV has killed so many people worldwide. But people are still dying from HIV because there's not a lot of willpower to be able to bring that, vaccine. So bottom line is COVID-19 vaccine is safe. It is also effective in reducing and the severity of the disease of the virus once you get it, and making sure you have a positive outcome compared to if you don't take the vaccine. And COVID-19 was made fast because of the context. The US government wanted a vaccine, so enormous resources was put into it. And I think we need to just put things in the context when we're talking about COVID-19 vaccines. COVID-19 had predominantly it had an adverse effect on the US, and there was willpower from every inch
from
of the
everywhere.
government to be able to make sure we have a resolution. And that's why COVID-19 was made so quickly. So please get your vaccine. I think we need to just ingrain into folks that COVID-19 is here to stay. I think one of the reasons why people are not taking our vaccines, because they felt like COVID was a thing of the past and now we can move on. But somehow we need to change the narrative and say COVID-19 is like influenza. Now this is now more endemic. It's seasonal. It's going to be here to stay. So we need to put into our mind, just how we know every year we need to take the flu shot, we need to ingrain into our minds that every year now we need to take a COVID-19 shot.
And then maybe a booster shot every year based on, the variant of COVID.
Correct.
Yes.
Or
But
to add to what Dr. Buller was saying, ask yourself though, if you know like the dangers of the COVID-19 vaccine, but you have never checked on what the dangers are for Tylenol or for ibuprofen and you still swallow it, you should check yourself out, right?
Mhm,
It's
mhm.
like every medication we take is based on a chemical you're swallowing, right?
Mhm.
And everybody's our body is a little bit different from everyone. And one of the reasons too, sometimes we are skeptical of those vaccinations is all of any new thing in medicine is when the pharmaceutical companies are doing the testing and the planning of these things, we are not at the table, right?
Mhm.
I can remember even when Pfizer put out a public announcement when they were still testing their vaccination, they were looking for like 40,000 people to volunteer.
Mhm.
I don't remember seeing any African in our line to volunteer, right? So
Mhm.
it's like they do the test, they do the efficacy testing and stuff like that on other people, and then when it comes to doing the getting the benefit, then we go at the receiving end. So one of the ways to deal with this thing is for us to know that instead of just sitting aside and being skeptical about new innovations in medicine, we need to be at the table. We need
Mhm.
more of us to get involved so
Mhm.
that there will be more information about it. But the medication, the vaccination is safe, like Dr. Boley said, the very first phase any medication goes through or vaccination goes through is safety. Like
Mhm.
how much of this thing can kill a person. There's a very thin line between medication and toxin. Anything that you take as a medication, if you take too much of it, it might kill you, right? So they have to establish that safety guideline before they can even start testing anybody. So all the thing is not about safety because it's like if you were so much concerned about safety, it's like what other medication do you take? Have you checked the safety record? The
Mhm.
car we drive, you know how many people die from car accidents every year in the United States? Why haven't you checked it out?
Just
Right?
check.
I was on a flight to Atlanta last weekend. I don't think I've checked out how many people died from. Yeah, I mean, so this whole some of our skepticism of the COVID vaccination is also because society is polarized, but it's not about safety. Every medication we have out there, there's a small group of people that will
Mhm.
have an adverse reaction to it.
Reactions.
They
Yeah.
even have people that have adverse reaction to aspirin, right?
Mhm.
They
Mhm.
have people that got liver damage from Tylenol. They got people that got all kind gastric bleeding from Motrin, and we take it all the time. So if we go by this small example of people that have an adverse reaction, then suddenly it's like, oh, something like that. It's like we need to go over and beyond that. But I can tell you, I've taken all the vaccines. I took the original one, and I've taken the two other boosters beside that. I talked to my family, and we are all involved and engaged. We are not just saying the vaccine is safe.
Mhm.
We
Mhm.
have taken
Really
it,
taking it as well.
Mhm.
And
and
I
we're
just
still
wanted
here.
to echo what the speakers were saying, and then we can. I know Miss Keisha has a statement. So from what I'm hearing from Dr. Pine and Dr. Emma, like anything else, we prioritize situation when there's need to be prioritized. So the vaccination is not the time that it was made, is what was put into it. People have questioned that it was made too fast, like Dr. Emma said, in 18 months, and other vaccination have taken like years to be made. So it was made 18 months because we had a global pandemic. So it was a global crisis. So a lot of resources, a lot of time, and a lot of effort have to be poured into it to be able to be created. So the vaccination is safe. We have for the last 6 months, we have trained on over 200 trusted messengers. Dr. Chessa, Emma, and Miss Keisha. We put together a team. We trained over 200 trusted messengers. We reached out to thousands of community members, and we have Miss Fatuma on the phone as well. She's one of the coordinator for our East African community and did a extraordinary job reaching out to her people in the community. to educate them about vaccination and COVID, and not just about the vaccination and COVID. There's a lot of resources available to us as African immigrants in America. And sometimes, one, we don't know that it exists because we don't have advocates in our community that would tell us where they are. So part of this program, not just to tell people go get vaccinated, go get your COVID test, is to be able to link us to resources that are available to us. We're all taxpayers. And if there's emergency like COVID, where you have a friend or a family member or yourself that was unemployed, that couldn't pay your rent because you were sick or because you lost your job, you lost your health insurance. If you don't have health insurance and you need help applying for health insurance to be able to go to the doctor to get help. So our role in this community is to be able to link people to resources that is available to them, how to apply for insurance to get free medical care. If you need workforce centers that provide free trainings, if you need money to help pay your rent, if you need to take a continuing education course to enhance your career, those are resources that we provided to the trusted messengers that we train. We send it out in this very community. We were in churches, at the malls, in different community centers, and training people and letting them know that these resources are available to us. Other community are making use of it. Is available to us if we need it, and we can go and get it and get that help. So like we said, the COVID vaccine, like anything else, prevention is always better than cure. Yes, when you get the COVID vaccine, you may still get COVID, but like the experts on here are saying, Dr. Chesa, Emma, Nurse Keisha, Dr. Khan are saying, if you do get vaccinated and you do get COVID, the impact is different. It's different on your body. It's different on your body. So the vaccination is safe. The resources are there for you. We can link you to some of the trusted messenger in your community. If you need some of these resources, we can link you to them. And this program was made available and possible through the Minnesota Department of Health, a collaboration with them. So we will continue to talk about this, and I will turn it over to Ms. Keisha. We have a couple of questions, and we can take some questions. We can bring people in. If you have questions for any of our professionals here, they can answer it. And we can go on from there. Ms. Keisha, you have a question or a statement?
Well, I don't want to talk about COVID. I mean, I know we hear about mental health and COVID, but I don't want to talk about COVID. I want to talk about,
I have a couple of
for me, what I have seen in the workspace is that COVID has taken over pretty much everything.
Mm-hmm.
And it has eliminated person-to-person contact. Simply, okay, let me give you an example. I was in the clinic with my mother. My mother has a disability. She uses a wheelchair, right? She goes into the clinic with her sister. As soon as she gets through the door, the mask is below because she has difficulty breathing. We have lost human connection. And for me, that is huge. I don't give a rip what you say about COVID. Humanity matters. Period. Mm-hmm. And if we can't treat people like people, and we so focus on what COVID is doing and has done, we're going to lose more people than anything. Mm-hmm. So my main concern in all of this is making sure that humanity is at the forefront. If you are having to deal with this issue and you need to wear a mask for whatever reason, the same way you communicate with someone when you don't have the mask on is the same way I ask you to communicate with someone with the mask on. And you communicate non-verbally. You can communicate with your eyes. You can communicate with your body language. You can communicate with your ears, whatever the case is. You even have some people move their ears around, right? But in other words, don't disconnect from the person. That to me is is just so disgraceful. And I see it so much in healthcare. So much in healthcare. The first thing somebody walk in the door, the first thing you say, put your mask on. You didn't say hello. You didn't say how you're doing. You don't know what the person has dealt with before they even got to your space. You didn't give them a compliment. You nothing. The first thing come out your mouth is put a mask on. If you don't,
Human connection.
human connection is huge. So that's my, I just really want my community to hear that.
Mm-hmm.
Humanity matters.
Mm-hmm.
Diseases will come and go, but the people in your life, the interaction that we have with each other matters. Let people know you matter. Mask and all. Will you please do that for me?
Yes, I
All
will.
right, thank
That's
you.
the first
Because
thing.
that will heal a lot of mental health. If people know you care, that in itself will heal mental health.
So all the
Can
practitioners,
I can I just say something? Can I just say something quickly?
Dr. Shasta,
Can I?
are you listening?
Okay.
Dr. Fa, are you listening? Because you guys see patients.
Yeah.
So
Uh,
what Keisha is saying, when a patient walks through the door, even if they don't have the mask on, don't treat them like an alien, right?
Please.
You should always welcome them, connect with them, or find a professional and not panic, right? And that's why I asked the question before to Dr. Chester. I said, if you're going into the doctor, what are some of your expectations of your patients? Because sometimes us being on the other side, we don't know what to expect. And she did a great job outlining. If you're going to your doctor office, write down your question, bring a list of medication. So, and all of that. So yeah, so that was a good one. Dr. Emma,
well,
Can I just say
yeah,
something
okay, go
quickly
ahead,
to
Dr.
what
Boyd. Go ahead.
Keisha said? I think it is important. It's important. I think that's what we need to prepare ourselves for the new norm, because masking, I think we shot ourselves in the foot as US, because this thing could have been long gone. When COVID-19 happened in the past, and there was this boost, this widespread vaccination campaign in 2000 to get people vaccinated. The point was to be able to get about 80% of the population vaccinated so we can achieve herd immunity. If we would have done that, it would have reduced the likelihood of spreading. We will be passing
Exactly.
around without masks and everything. But the US right now, I think it's only 60% of the population are fully vaccinated. I think even less than that. So we have never and will never achieve herd immunity. So now masking will have to be a way of life. And so we need to find a way to be humbled and let, like what she said, do it with humility so that we treat people as people, because we didn't do ourselves justice by nipping COVID-19 in the butt, by getting vaccinated. If we would have achieved herd immunity as a country, where 80% of people would have cared for their neighbors, would have cared for their family members, would have cared for our communities at large, we will not be having to deal with masking for the next whatever 10, 15 years or however long COVID-19 stay around. So we need to find a way to live with it and be humbled and treat people as humans when they are sick or when they are coming into hospital settings.
Yeah, let me come in. Like when Dr. Bole said earlier, in testing medication, the very first thing is safety. When you go to a healthcare facility, the very first thing is also safety, right? Even
But before
though
safety, I
regard,
need for you.
Let him finish.
Before
Let
safety,
him finish.
I need
hold
you
on,
to care
uh,
about people.
hold on,
Before safety, I need for us
hold,
to care about people, because people died because they felt left out.
I am not arguing that. I
Okay.
mean, we even have the word care in our professional health care. We're talking about caring. And there's the philosophy that nobody cares what you know until they know that you care. Now, most of us will not even be going to work in the middle of a pandemic if we didn't care. Now, when you walk into a facility, okay, if you are coming to my home, I know what's up. Now, if I, for example, I have a clinic here, if I have 6 people in this clinic, with different immune systems and different immune levels. Okay, their safety becomes prime, right? I personally, I think I'm immune. I'm healthy. I've taken all the boosters. If I do get COVID, I expect it to be mild. So I mask if I have to. If I don't, I don't. But and I'll meet people. But if you were to walk through my door here, if I do have other people here whose immune systems are compromised, I'll meet you with a smile at the door, but we still require you to put something on, not because of you, but there are other people in the facility that might be more compromised than you are. And like Dr. Chester said earlier, when you walk through the door, we don't even know what's up with you. We don't know what you're bringing in. We don't know what risk could be coming in. On a personal level, yeah, we will come. I will even give you a handshake. If it's a guy, give you a little tap on the shoulder or something like that. But if I do have other people in the back, safety, trust me, it may not look like the primary thing to you, but if somebody can prove that they got sick and they got sick in my clinic, it's huge to me. It could put me out of business as well. So on a human level, why it's true that we still need to maintain that. Remember, we come to work because we want to maintain that human level. We like to see ourselves as resources, but also people that are helping establish and maintain that human connection. That's why we come to work, right? Once in a while, somebody's going to get on your nerve, but remember, they too might be frail, right? Like every time there's a COVID epidemic, what you think happens to us that work in the hospital? Like Dr. Bowley said earlier, if we all took this vaccine, 80% took the vaccine, we can get rid of this thing. But because we have not as yet gotten 80% take it, every time we think it's over, a new stream pops up. And then we have to go through the same thing over and over. I got kids, I got family at home. There were times when I have to stay in the garage and undress so I can bring it into my house. And then when it's over and I'm dressing again, then a new string comes up. What do you think happens to us?
Absolutely.
Right?
Yeah.
So it's all over. We all need to step up and take some sort of responsibility and say, listen, stuff happens. And sooner or later, if we work together, we can get rid of this whole COVID thing once and for all.
Yes.
The vaccine is good, it's safe. There's no medicine out there that comes without a warning that say if you have not taken this medicine before. I keep going to Tylenol and ibuprofen because I know everybody takes them.
Right.
But there's a warning on that bottle that say, hey, if you haven't taken this before, it might do something to you. But we still take it.
But we still take
Right?
it.
Yeah, I just want to add this piece because it's so critical. And I know my field of expertise is person-centered care and patient-centered care. Even before we think about safety, even if safety is our primary goal, you still do not elude or abstract human connection. Give you an example. When someone enters your medical door for service, it's not that you're immediately thinking, oh my God, everybody's a disease. No, it's the internal conversation that you're having with yourself. Everybody that darts my door, before they enter, I am going to greet them some kind of way to make them feel comfortable. Good morning, Mr. John. I so appreciate you for being here today. Because we want to make the space safe, everyone has to wear a mask. How are you feeling today? Perhaps give them an opportunity to say something before you go slapping a mask on their face and treating everybody like some number. People are human. And in my community, working with elders, we have had over 75% of our elders die because they felt like the mask was more important than them. And that is my message. There is a way for us to communicate that. We don't have to just treat everybody like some number.
And we're talking about stigma before.
Yeah.
Keisha, Keisha,
Yes,
is this
I'm
the forum for that though?
passionate about this.
Keisha, Keisha, is this the forum for this though?
I hear you,
Um,
Keisha.
It's
I,
like not the forum for this.
what you
uh,
Because
say?
I mean, you are speaking to something that needs to be that should be heard by large system medical providers.
And that's why
This
I
is
do
not
it.
the
Yeah.
forum for this. Because this, my understanding was we're going to be talking about the mental health of people as it relates to the COVID pandemic.
Mhm. And that's
Okay,
the
so your point is well taken, but it's not the forum for it right now. I think we should get back to the on course to talk about the fact that people had more mental health issues around the COVID pandemic because they were so isolative. My understanding and what I saw personally was how you had patients who were admitted to the hospitals, and whereas they're accustomed to having family members to come to visit with you while you're in the hospital, that
yep,
didn't happen. You have people where you have elderly patients who are in nursing home, and you're used to every Sunday your family come to spend time with you. That wasn't
yep,
happening. And those
yep.
all are things that had impact on people's mental health. So while I
Very
appreciate your
true.
concerns about we need to maintain the humanity of healthcare, we are talking now about how this COVID pandemic affected people's mental health during the heart of the pandemic and how it is still affecting people's mental health. I would like to just talk real quick about Emma had mentioned something about how we as Africans, we utilize our network for our
Yep,
counseling.
it's
And I
true.
meant I was going to say that before, and I said no, don't bring that up here. But since you opened the door, let me go there. It is not unheard of to call Cole Fungalo and say, "You're my friend. I'm going through this. Hear me out." And she hears me out as I just go through things and just unburden. That about mental health is just unburdening your issues, your concerns to someone who will listen empathically and not counselors do not give you advice. They just listen and help you work through the problems. And that's what we are accustomed to our friends doing and our family members doing for us. Your point is well taken, Dr. Bowley, where if you want confidentiality, number one, you have to know who you're talking to and know that they will keep your information to themselves. And number two, you can't sue them. Whereas with this a medical provider, yes, you can go after them from a legal standpoint. However, I think we as African, we our mental health is centered around our social network. And what COVID did was tighten and remove that social network. So we're having more and more emergence of mental health um, concerns and issues around this COVID time because that network was removed. We couldn't socialize like we used to. We couldn't just go over to people's houses and sit around and drink and talk crap and unburden ourselves in a safe space. And that's what
True,
happened with COVID. We lost that with COVID. Okay,
true.
and from an African standpoint and from a non-African standpoint, because I work mainly with non-Africans on my current job, that same you had that same phenomena occurring, and you have people having the same reaction where you're more isolative, you're not able to unburden and get together with your friends. People do Friday night happy hour. You couldn't do that anymore, and that's another way of therapy right there. So yes, as Africans, we view mental illness as a stigma, but we don't realize that we are already taking care of our mental health when we socialize with our friends, unburden to our friends, go sit around and have a social circle where we're drinking and talking and just talking about things. That's our mental health care right there, and we do it on a regular basis. But with COVID, we lost some of that, and
Mhm.
hence we're having more and more emergence of issues.
Fatuma said it earlier too in the Somalian community, working with
Mhm.
elders. That's how they cope. They're used to talking to people that looked at them, that sound like them, and then the culture barrier. And I think the last section we had, someone made a really valid point about death. The same thing with death. Like when someone died, the way we grieve or we get comfort is going, going through the repast, the funeral, and everything. And with COVID, and we have closure by seeing the body and going through the whole process. But COVID removed that.
Hmm.
You couldn't even see the body. You couldn't even be at the funeral. So that alone, not having closure, affect your mental health because you didn't have a way to cope with that. So, and I think that's why this conversation is important, and that's why we need to pay attention more to getting that help like Dr. Khan said, you don't have to be down. You don't have to have a meltdown before you seek help. All these little things require, you to take a stand so that before you get worse. So thank you very much. We'll move on to the next topic
Question.
so we can wrap up. Time is well spent.
I have a question for
Go
you.
ahead.
All
No,
right.
I'm gonna go. I'm gonna.
No, I'm gonna ask.
She can ask a
I was
question.
gonna say something quickly, but go ahead.
I will ask
Oh,
everybody to
okay.
speak.
Okay.
Okay, let her go there.
Go ahead.
Yeah, I was just gonna say, I think, that, and that's why it's very important to find positive coping mechanisms to be able to deal with problems in a positive way before it become a crisis. I think we Africans, we've been through this multiple times. During the Civil War, some of us lost family members. We don't even know where they were buried. Well, maybe instead of us looking for closure around where they were embarrassing about it, maybe a positive mechanism can be looking at thinking about the memories you have of them. So I think that's why it's very important to talk to mental health practitioners, because life is always going to find us in places where they're unpredictable. There's always going to be situations where how we know how to do things may not be positive. And so we need to figure out how we define how we cope with things in a positive way. And so I agreed. I think that was said the last time we met, that death can be very hard for us. We Africans, we grieve in a sociable way, but then there are some times in life where you may not be able to do that. There are some times in life where your family may die, or your mom or your sibling may die in Africa, and you can't get there in time. Well, are you going to deal with that in a positive way or negative way? I think that's why it's very important that we find places, safe spaces where we can talk to counselors or people who are trained to be able to help us and say, okay, these things are going to happen, and here are positive coping mechanisms on how you deal with them. I think that's very important. I think that's one of the lessons we can learn from COVID-19, because COVID-19 took us out of our game. We had to adapt to a new way of life. And so, just making sure you have a safe space to talk to people who are trained to say, okay, these are some of the strategies you can use to cope in instances where it's different from your norm or how you usually do it.
Yeah,
This
and
is
you might just get a pointer there too, because if I see 50 people with the same problem, and you
Mhm.
came to me, I'll be like, you know what? I know somebody else who had the same problem, but this is how it worked out for them. So when you come to see me, I have a little bit more latitude on how to help you than your friends that are going through the same issue with you, right? But because I see a lot of people, I might give you new tools or new coping skills to deal with the same thing that what your brother, your cousin, or your grandma could give you. So I mean, the fact that human connection is necessary,
Mhm.
there's a lot of research out there that even depriving people of human connection
Mm.
creates some level of
Oh,
mental illness. But
Mhm.
yes.
with the with what we do here in mental health, we have bigger issues that are cultural. We come from an expensive culture where we like groups, and we live in a place that is individual. So even if COVID had not come, just being in a culture that does not support our type of, we always in a group, we always got a big social group going, and then you move into a place that's a nucleus family. When I say family, sometimes it's because we're from the same town, right?
Mhm. Mhm.
And
Mhm.
you move to a country where family means your wife and kids. There's some issues there, but
Yeah.
so a lot of people suffer from that exclusivity when you got COVID, but and the isolation. But there was also solutions that some of us did not seek or did not want to seek. And I think part of this forum is to empower our people to seek help that is available we are some of the
And
help that is available.
and Dr. Kwan, some of the things, I mean, we could go on and on and on. We have one more question about this topic. You know, I was feeling a little sense of emotion as we talk about these things, because this is something we really never come on live to talk about in our community. And these are topics that really affect our community, our youth. Like, you know, we can, like I said, getting off topic, because I have a friend that just last week lost her son to drugs in his apartment, you know. And he, you know, like human connection, he lost his son to drugs in his apartment, and he was there for 3 days before they found out he was dead, you know. Point. And then, you know, and this new global culture, social media, because people are not having time. During COVID, people couldn't connect, so social media became a thing. So people will go on social media and do things that they probably won't do in their regular lives, because it's a platform. So, I mean, we need to talk about these things, and we need to educate our community. And I know some of the reason we don't talk about it, because our community, the African community or other community, we're so close that when one person get information, it trickles down so quickly. And that's why these professionals are there. And it's a give and take. Sometimes people feel that they trust their own, and some people may not trust their own because yet of the same confidentiality issue and trust issue that things may linger. But whatever way that you feel comfortable, whether you feel like you can do it with a therapist that is your own, that will understand where you're from. But if you feel like you don't feel comfortable with a therapist that is your own, there's many. You know, you can go to that one. That one can refer you to one that you feel like can, you know, help you. But we need to get help. We need to seek help. But thank you guys very much for this topic. We're just going to move on to the next topic. I know it's the end of the work day and people have to go home to their family, have dinner. So we're just going to, I try to keep this to an hour, max hour and a half. We're about hour 15 minutes in. So I have one more questions, and everybody can go around and answer, and then we'll wrap up, and we will see you guys again soon. The question that I have is, we want to talk a little bit about disaster preparedness, emergency preparedness. I know the pandemic came and it took a lot of us by surprise. Even the giant, the United States of America was not prepared and was not equipped. The health system was exposed because we thought this was the best, and even though it is still the best, but it was exposed because a lot happened, like the shortage of supplies, the shortage of, you know, a lot of things happened. How are you preparing in your space? Let's say if there was to be another variant that we weren't prepared for. Dr. Chesa, you work at a hospital. You know, I have a home care company. I mean, I can speak on how I'm preparing or how equipped my company is. But how are you preparing in your space for emergency and for disaster? If there was to be another pandemic that's not COVID or that is COVID but a different trend. Dr. Chesa, how are you preparing in your space?
Well, one of the benefits of working in a system is all of these things are done system wide. It is done system wide where policies are put into place. We have learned a lot. One of the best things I saw happen at my facility, number one, right away our CEO recognized that we needed to have a committee, like a disaster preparedness committee, and we met twice a week on Mondays, and on Friday we met to see what the state of the pandemic was and come up with ideas. How much supplies are we going through? How much patients are coming through the ER, getting admitted? How are the supplies chain looking? So we have a system in place now where as soon as things have to ramp up, I tell you other times I'm on call, and you're like, you're on call. Yeah, I'm on call in the hospital taking care of patients. During the heart of COVID, our census went from maybe you have maybe 5 or 6 patients a day to 13, 15. So we have a system in place now where you have assistants coming in to help you when you're on call around. You're not there by yourself taking care of 15 to 20 patients by yourself. We have a supply chain that's constantly getting refilled. We don't run out of stock anymore. We bought so much supplies that it's already in store. So that's the kind of preparedness that our facility is doing. As a provider, how do you get prepared as a provider? You're just always ready. Get ready for all the training that occurs around disaster preparedness. You make sure you're up to date on everything, and you keep reading, and you keep um, being part of the committee that talks about what the next steps would be if something else like this happened. And we do have a committee established at my facility where we have regular meetings to say point A, point B, this is what we'll do next, what we'll do next, what we'll do next. And that's what's really impressive to see. And that's one of the best way to be prepared. You got to be in the time of peace, you prepare for war. In the time of abundance, you prepare for lack. And that's what we've been doing at the facility here. And that's a good point to for people to keep in mind. When things are going well, prepare for the time when things are not going well. And that way you're not surprised when things are not going well because you already have prepared for it. You've already practiced it. My background is in the military. And I remember twice a year, we used to have these major disaster drill. I was on the air base. So we had this casualty drill where an airplane crashed on the base and we had to triage patients and prioritize who was more important than the next. And that was just a good thing to be just so you're always on the lookout when something happened and you've practiced it in advance. It's not a big surprise for you anymore. When you've never practiced something, there's more chaos. But if you practice it regularly, you're prepared for the disaster when it does occur. So all I can say is you have to have a plan in place, discussion with your key people, and just be mindful that this could happen. It could be crazy again like it was back in 2020 because this virus, as Dr. Foley said, is not going anywhere. It's here to stay. From the onset, from the very on March 13, 2020, the pandemic was declared. I will always remember that date. And I always tell the people, from that day, I tell you, this will become like the influenza vaccine. Influenza will have a variant strands all the time because that's what viruses do. They mutate. That is the nature of a virus. They mutate and change, trying to infect you. So you can get all the vaccines you can. If it's a bacteria, it's a little bit easier. But for viruses, they mutate so much. Be prepared. So yeah, just be prepared. Be on the lookout. It's going to happen.
Can I go next quickly because I have to drop off quickly here? So,
Yeah,
Dr. It's funny that she's a clinician, so I agree with everything she said clinically. But what I would say here is, COVID-19 happened because someone said this to me. When if God forbid someone would attack the U.S. tomorrow, there will be a military response. We have policies, we have coordinations with our defense ministry and all of that. The U.S. would be ready for. In fact, even now with the Israel and Hamas situation, the U.S. is actively engaging in war overseas. We have a coordinated response. What the US doesn't have is a coordinated public health response. And that's why COVID-19 was the disaster it was. And I think we need to really be careful when we talk about, clinical health and public health. The difference is the unit of analysis. When we talk about health, we talk about how do we treat people that are sick. When we talk about public health, we're talking about people who are sick and people who are well. So there needs coordinated public health systems in the US, which we don't have. So we need to be able to look at community health workers because guess what? The US right now, a lot of people cannot afford medical school. There's been a decrease in patient to clinician ratio. So who's going to take care? Who's going to coordinate isolation and quarantine? Who's going to contact trace? There needs to be, the US has to invest in our public health systems, which we do not have right now. Even if you look at the Center for Disease, CDC, it's a Center for Disease Control. Prevention is at the end. But I think until we get serious about public health, the US doesn't have any laws to legislate what will happen in the event there of COVID-19. We still don't have it, but we have systems in place. We know exactly what will happen if the US was attacked. We already have a defense mechanism in place. So we need to learn from COVID-19. Other places have it. COVID-19 did really bad in the US here. Other places learn from Ebola and other pandemics that happen. Globally, they have a coordinated public health. Like right now, Rwanda have community health workers that they're paying, because they understand that community health workers are the key to be able to equip go to those last mile places to bring health to communities, because guess what? Clinicians are valuable, but it will require people to get sick and come to the hospital. So
Yeah,
what
hospital,
happens
but we
if
can prevent.
they
Yeah.
don't come to the hospital? So I think the US, to be able to avert another COVID-19, we need to have public health
Oh,
systems in,
yes.
we still don't have it.
We
And
don't have.
sadly, I don't care. You can stock the hospital with all of it. You will not have enough clinicians to take care of people. You will
Mhm.
never have enough until you build a proper health workforce to put mechanisms in place to be able to prevent, disease spreading, to be able to educate people. Clinicians cannot do it all.
And
They
control. Yeah, control is.
they were trained to take care of the sick. But
Mhm.
what happens in preventing people from getting sick? The US has to answer that question, and we're nowhere near close in answering it.
To that.
Absolutely.
Thank you
Absolutely.
very much, Dr.
Yeah,
Wally.
yeah, yeah.
Thank you very much. And as we know, most of these things can be prevented if it's controlled. So
Mhm.
that was a very valid point.
Mhm, mhm.
Keisha, I know you wanted to say something. Go ahead.
So I wanted to, as we're talking about preparedness, right? And I know we're specifically talking about the US of A, but when you think about preparedness, I want to know, like, what happens to our countries outside of the US? How are we preparing them? How are we getting them ready? How are they getting the information? And like Miss Emma just mentioned, our community health workers are absolutely fabulous for something like this. But I want to know, like, even when we on our last medical missions trip, right? I mean, there were things that I saw, especially the one hospital that we went to. I can't remember the name of it. Basa.
Hospital.
That place is just like they weren't prepared. People were having emergency surgeries outside of the surgery room. So, how are you all, or how are we as practitioners, as people with information, how are we helping other communities and countries be prepared? Miss Cole,
Okay. Well,
please.
yeah. Now,
Well, that's a big conversation.
yeah.
Uh, in most other countries, especially industrialized countries, besides the United States, healthcare is a right. They provide universal health care. And so they take out the private money. Healthcare is not meant for profit, right? So in those places, they have a little bit, they put more of their investment in prevention, right? We have a system here where the healthcare system makes money when people are sick. So they are not vested in keeping people well. I think in the last thing, in the last presentation, Dr. Bowley was saying something like, "Hey, look at HIV. It's been around 40 years. You think we really can prevent that?" Look at diabetes right now. It's like every time you turn the TV on, there's a new diabetes medication, right? So there's enough money to be made in it, and as long as healthcare in the system is for profit, that and profit becoming the driving force for it, there's not a lot of things we can do because the system benefits from us getting sick, right? So, I mean, we as a people have tried once and failed. I think we will keep trying to see whether we can bring some kind of universal healthcare where we take healthcare, like this whole for-profit healthcare thing started like in the 60s, right? Before the 1960s, in the United States, almost all the hospitals were run by the county or by a church,
Mhm,
right?
mhm,
So profit was kind of like minimized,
Yeah.
mhm,
right?
But
And
now,
then after this, during the 60s, and after that, when certain people thought, oh, they didn't want to go to the general hospital, let's build some for certain people that can afford it, and it started seeping into our system. And next thing you know, our entire system is now for profit. So we
mhm,
as a people, if we first want to do something that will be significant about the healthcare system, is to remove that money motivation out of it so that healthcare's primary objective will be keeping people healthy, not treating sick people, right?
Yeah.
And
So yeah,
if we as a people do that, we'll be fine.
yeah, that was good. Thanks, Dr.
Mhm.
So, I mean, like, I think what we gather from this piece of disaster preparedness, emergency preparedness, Dr. Chester had a valid point, and Emma came and spoke. Dr. Chester spoke from a clinical perspective, and I like this forum because we have a lot of brilliant experts that come in from different places and different backgrounds. Dr. Chester spoke from a clinical perspective on, how to prepare. And then Emma came with a brilliant idea too from a public health perspective on how to prepare. And it boils down to, if we prevent, then we don't have to treat, right? If we prevent, then we don't have to treat.
Absolutely.
So public health is very important, and clinical is important. Clinical health is important. So if we prevent, we don't have to treat. Like you were talking about Liberia and about our last medical mission to Liberia, and when we went to Buchanan Hospital, and what you saw there and stuff. And like going back to Liberia, most of our illness that is most diagnosed, like malaria, typhoid, cholera, all these things. All of it are preventable illness. All of it are preventable diseases, right? What do? It don't have to occur if you take preventative measures.
Absolutely.
So and that's boiled down to the COVID. You may not have COVID if you take the vaccine. If you take preventative measure and drink clean water, there's go cholera, there's go malaria, wash your hands. So prevention is what, as the old saying goes,
Better than cure.
so if you prevent, we don't have to cure.
An ounce of prevention is better than a pound of cure.
And if you don't want to cure, if you don't want to prevent and you want to cure, then it goes down to the expensive method, right? Because you had to pay the money. And preventative care is a lot cheaper, less time consuming than cure.
Absolutely.
So that's what I would like to close out. And I'm sorry, it's getting dry in here. Everybody can go around and just give a word of inspiration. I'm sorry, as we close out. It's time to go.
All right. So let me go first. On a practical level, the United States government have a website called ready.gov. If you go to ready.gov, there's a little basic preparedness, disaster preparedness kit that advice. They'll give you some advice on how to get a little kit for yourself just in case there's a big disaster going on. So those of you that are interested in having a little kit in your own home, go to ready, redy.gov, and there's some advice there on what to do to prepare for disasters. It is always a good thing to talk about mental health as well as mental illness. I hope one of these days when we come in, we will actually talk about mental illness, what they are, so that our people can know. Because the last time I had a presentation, almost everybody that came out was like, I don't know that was mental illness. Or I think I got that one.
We'll have a
Right?
section just on that where we can bring some other mental health practitioner, and we can just, we need a lot of education on this.
Yeah.
Like I said, and when it comes to drugs and mental illness, the mental illness are tied to the drugs abuse, because our youth are abusing these chemicals that causing another form of mental illness, and causing death. I have a friend that just lost her son last week.
Yes.
And from what was it, meth or fed? I don't know what it was.
Something with fentanyl in it.
And he was found dead in his apartment. How disturbing is that? If you talk to people, a young kid, and how drug abuse, induce mental illness. So we need to have a conversation outside of COVID. We can schedule something, once a month, twice a month, and we can do education. We can link people to resources. Even if it comes down to where do you go to find safe marijuana, because not all the marijuana now is safe. If you want to smoke it, go get the good one. We got to teach the stuff instead of getting the bad one, because somebody thought they were smoking regular marijuana. Somebody put something in the marijuana.
Yep.
So now that the government have legalized it, if you want to smoke, go smoke, but make sure it's some good some real natural stuff. I mean, like,
So like, Carl, when we talk about that, is like, okay, when I see people like that, is they our primary objective is why do they need the drugs, right?
mhm,
Something
mhm.
else is going on that makes a person want to live in an alter ego state, or to live it,
Yeah,
they're seeking help. Sometimes they're just seeking it from the wrong place.
from the
There are
wrong
people
place.
who can't sleep unless they get drunk,
Mm-hmm,
right?
mm-hmm.
But the problem is not the alcohol. The problem is they have trouble sleeping, and there's help,
In our youth, it could be peer pressure. It could be a thing.
you know.
The youth.
So yeah, we one day we will talk about it,
We'll talk
and
about that.
we
Yeah,
hope we
off
will
the
be
topic.
able to help as many
Mhm,
of our people as we can.
Mhm,
It's always a pleasure to be here. It's
mhm.
always we see it's a good opportunity to talk to our people and to just let them know that help is available.
It's available.
Uh, we are part of the resources that is provided for the community, right? The
Mhm.
resources that are available to the community. We make part of that. Now, if the resources are available but you're not using it, well then it's on you, right?
If you know
If you
where it's
don't
at.
want to go to white people, they got black people available. If you want to go to only Liberian people, now we got Liberian providers
We got
available.
librarian providers.
Help is available,
Health
but
is
you still
available.
got to get up and
And get it.
seek it. Even
Mhm.
Jesus himself, he's like, I stand at the door and knock, and you got to get up and open the door before I
Mhm,
come inside. There
mhm.
is an expectation that we have to do something
You got to do
to get
something.
what we want.
You got to do
And the
something.
healthcare is not going to come to you to your house and make you take it. You have to have some level of interest in your own health and then seek help. Help is available.
It's
mhm,
available.
mhm, mhm.
Yeah, so I think even part of those linking to resources, we have to find out some places in Minnesota that are licensed to sell this marijuana and link them to where
Mhm,
they can go get a safe marijuana.
mhm,
Mhm.
That hasn't been part of things we can do. Sending them to, because now everybody's saying, oh, it's legal. Yes, it's legal, but not depending where you go, it may still be harmful because it's not good to you. So, we need to find some of these places that are licensed, that are selling these things, and put them in part of our database to link people to places to go and find them.
mhm,
But those are things that we need to educate, because it's a serious issue. It's a serious issue. But Dr. Chester, do you have any words of inspiration as we wrap up? We kind of got a little bit emotional and got off a
I
topic.
know.
We're trying to wrap up now.
Well, I was going to just say, in terms of the medical marijuana,
Mm-hmm.
I am a certified medical marijuana provider. And there are only, no, listen, there are only 13 certified dispensaries in
Approved.
the state of Minnesota, only 13 of them.
Hmm.
So if you want to get medicinal marijuana, a
Well, there you
physician,
go.
a physician has to prescribe, and you have to enroll with the with the
Yeah.
Department of Health to
Mm-hmm.
get medicinal marijuana. And
Mm-hmm.
that's one of the reasons why it is important. Marijuana can be used as a recreational drug, but like
Mm-hmm.
Dr. Kwan said, there are reasons people are using it, not
Mm-hmm.
just for recreation. It
Mm-hmm.
also helps with anxiety, it helps with
Mhm,
appetite, it helps with
Mm-hmm.
sleep. So people
Mm-hmm.
may think they are using it just for the sake of being smoking marijuana to have fun.
Mm-hmm.
However, it's a way of also masking some
Mm-hmm.
mental illnesses.
Mm-hmm.
So if you have those mental illnesses, and most of us who are from African countries that has gone through wars,
Or
that PTSD is a
PTSD.
serious mental
Mm-hmm.
illness.
It
The
is.
medical marijuana is indicated for PTSD. So some of these people who are taking it are trying to mask those symptoms that they're experiencing from the PTSD. So
Mm-hmm.
there's a lot more to it than just taking it, just smoking
Yes, you think?
marijuana. There's a
Yeah.
whole lot more to it than that.
mhm,
Yeah.
But I digress.
Yeah.
I digress. But I was
No,
going to
you didn't digress, did you, Dr. Johnson? You didn't do that.
That's just a word of inspiration,
I
and then
should
we can wrap
progress.
up and we can
I
come back.
think it's a great forum. COVID is here to stay. As we
Mhm.
mentioned before, the vaccine is safe and efficacious. I've seen patients who've gotten the vaccine, 95-year-old get COVID and walk out of the hospital. I've seen patients who've never gotten the vaccine, 45-year-old get COVID and end up dying. So the vaccine is efficacious. So please encourage people to get the vaccine. There's still hesitation for whatever reason, but please encourage your friends and family to get the vaccine.
Thank you.
Nurse Keisha, I would encourage my friends and family to get the vaccine because we know it does work. And on that note, I would say thanks for this. Let's do this again because it's important for people to hear this kind of conversation
We definitely.
by people who look like them. I keep saying this all the time. Studies have shown people of color get better outcome when they are treated by people of color.
True.
It's not biased. It is not. It's just something that just happens. You're more inclined to tell me the truth and be more opened if I look like you, sound like you, and can relate to you. It happens in medicine all the time. All the time. So,
Ms. Keisha, you want to wrap up? And then Dr. Chessa, thank you very much. And I appreciate you coming here. So we'll be back next month, midweek.
I was just going to say, actually, there's a survey that was done. I think it's called JAMA. And they did a survey. They followed like 161 brown and black people. And what they found was at the end of the survey, there was a 10% increase in brown and black people participating in their healthcare because not necessarily that the provider they had was the same color as them, but that the providers that was the same color was in the same vicinity. So they didn't necessarily have to be their provider. They just knew that even if I had a Caucasian practitioner, if I look across the street, across the hallway, I see somebody that look like me. That actually, their care jumped up by 10%. So representation matter, right? And then what I want to say to you as a closing is, because I'm a God girl, right? Everything I do is revolved around the Father, Son, and Holy Spirit. And I know most of the time we as people, human beings, what we try to do is do things outside of him. So my encouragement is, and I'm not telling you to do, this is me as a practitioner coming to you as Nurse Keisha in the community. I actually host every single solitary month a session called Ask a Nurse, where the community comes in and we have community dialogue. We actually did a couple of months ago where we actually participated in emergency preparedness. And each elder, we all came together and we actually put kits together. We walked through it so that they can have hands-on on what to do and how to do. Right. And with that, what that did was it gave them the empowerment, because now I'm not just listening to someone, right? But I actually have an opportunity to sit shoulder to shoulder. I now have an opportunity again, like we've been talking about earlier, to actually, while I'm putting my kit together, to talk to my neighbor, right? So my closing for you is, let this mind, your mind, not Cole's mind, not Dr. Chess's mind, not Dr. Sam's mind, but let your mind, you have control over your mind. Okay? So no matter what goes on in this world, just know you are responsible for you, and everything can be done until nothing can be done.
Thank you so much, Nurse Keisha. Thanks, Dr. Chessa. Thanks, Emma. Thanks, Fatuma. I know you left. I don't see you online. I don't know if you're there. Thanks, Emma.
Thank you.
Joyce was to join us today. She had to take a trip to Kenya, and because of the time difference, she couldn't connect. She's one of our partners overseas. But thanks everybody for taking the time to come in here to speak to our community, to serve our community. Thank you guys so much. We will make sure this will continue every month, and if need be, we can come twice a month to educate our community. But we'll be back next month. Is that February? We'll be back
February.
sometime in February again, and we will send information out.
Mhm.
If you're interested in being part of our discussion, please send us inbox. Give us inbox if you're an expert in any field or working have many years of experience in any field, or if you have a message for your community, just send us a message and we can invite you on to speak to the community. But I want to say thanks to everyone.
Thank
Happy
you.
New Year, and be safe, stay warm, and we'll see you guys soon. Thank you.
Love you all. Ta-ta for
Bye-bye.
now.
For politics, entertainment, news, and business. And this is KMTV. We are on your screen, we are everywhere. The best online Liberian platform you have. Make the best use of it. My name is Frank Adams, and I endorse this channel.